Pituitary drugs. The pituitary gland has two parts, the anterior pituitary and the posterior pituitary. Together with the hypothalamus, they govern all the body's functions. We have pituitary drugs, which will either mimic or antagonize the actual hormones put out by the pituitary gland. The anterior pituitary drugs are corticotropin, somatotropin, somatrem, actreotide. The posterior pituitary drugs are vasopressin and desmopressin. These drugs are used either to replace what the body is not making or not making enough of, or to diagnose. And that's to diagnose if there's a hypofunction or a hyperfunction of some specific hormone in the body. All right, corticotropins. These mimic adrenocorticotropin hormone, ACTH. They stimulate the release of cortisol from the adrenal cortex. Remember, that's sitting on top of the kidney. Cortisol is a corticosteroid, so it works as an anti-inflammatory and also sodium retention. This can lead to edema. Cortisol is part of the stress response of the body, so there are times you want to retain fluids. You know, if somebody's bleeding a whole lot or they've been in an extremely hot, sweaty situation, you want the body to retain fluid. So it's a positive as well as a negative. Corticotropin insufficiency can be caused by long-term corticosteroid use. That's an important point. Corticotropin can be used to diagnose but not to treat adrenocortical insufficiency. But more than that, it's often used to treat multiple sclerosis. It can be given IM, sub-Q, IV, as a gel. It is important that while taking these drugs, people maintain adequate hydration, but remember, it can lead to sodium retention, so sodium and potassium intake probably needs to be decreased. And while they're on this drug, we need to avoid vaccinations. If the drug is working well, and if they're taking it for multiple sclerosis, it should eliminate the pain associated with the inflammation that goes on with multiple sclerosis. All right, somatropin and somatrem. These are growth hormones. Your book uses the words linear growth. That means growth of the long bones. It means getting taller. So these drugs stimulate growth. Now that only works up until puberty when the long bones seal off. So it can be used for people whose long bones haven't sealed, and in cases of growth hormone deficiency such as hypopituitary dwarfism. Parents of children who are receiving growth hormones need to keep a journal reflecting the child's growth, making sure the pattern is reasonable. And we monitor for therapeutic response. That means kids should be getting taller. All right, vasopressin and desmopressin. Desmopressin is a synthetic vasopressin. Vasopressin is a potent vasoconstrictor. Just keep that in mind. A brand name for vasopressin is Pitressin, and the brand names for desmopressin is DDAVP and Stimate. Why do we use them? Well, they mimic the actions of ADH, which causes water resorption in the distal tubules. So diabetes insipidus is the big use for these drugs. However, they can also be used in various types of bleeding. Desmopressin is useful for hemophilia A and type 1 von Willebrand's disease. So, how do we know if it's working? Well, if we're using it for diabetes insipidus, the severe thirst should be reduced and the massive urinary output should be decreased. Drugs, all the drugs in this category, it's important to be sure that the drugs are not discontinued abruptly.